In a sombre TV address, French President Emmanuel Macron said a new lockdown was necessary because France's health situation had deteriorated rapidly.
Because of what we learnt in spring, this lockdown will be adapted. Schools will stay open, work can continue, visits will be permitted to retirement homes. But as in the spring, you can only leave home to work, for a medical visit, to help someone, for essential shopping, or exercise near home with a permit.
The number of new COVID cases is rising fast in France, with more than 50,000 on some days. More than half of the country's intensive care unit beds are occupied by COVID patients. This doctor says that health workers had warned for months that a second wave was coming and would be worse than the first.
November is going to be very, very hard, and we absolutely have, to break that wave that is coming, because if we keep accumulating really the cases and the cases, then very soon we won't have any beds anymore in ICU, really, not any.
For months, the government and president have urged people in France to live as normally as possible with the virus. But these new restrictions reveal just how challenging that really is.
The government has tried to navigate a delicate path, try to find how far it could go in terms of focusing more on health or relaunching the economy. The situation we are in now is a result of this precarious balance.
The fact that the new restrictions come less than 2 weeks after a nighttime curfew was imposed on most of the country could indicate that the government failed to anticipate the scale of the emergency. For some, a new lockdown could have been avoided. For others, it was inevitable. Either way, few would have imagined that they would be forced to stay at home again so soon. Natacha, Butler, Al Jazeera, Paris.